Hi everyone, my name is Jessica Weibel. I'm a public health nurse with the Leeds, Grandview, and Lanark District Health Unit. Today I will be talking about the Naloxone Narcan training. Revive Overdose Response Program.
So we'll move up to here to 3 minutes 20 seconds when they give you the signs and symptoms.
Between 2000 and 2013. Opioid overdose signs and symptoms. I'm going to read each one to you now. Breathing will be slow or not at all. The person is not moving or becomes unconscious. You may hear gurgling sounds or snoring sounds. Their skin may feel clammy or cold. Their lips or nails turn blue or purple. People may sound like they're choking. You can't wake them up, and their pupils may be a pinpoint or tiny size.
All those signs prove your heart's beating. Could be any of the hundreds of causes of respiratory emergency, and every nurse knows it. Any 10-year-old child with some common sense knows that's a breathing problem. So then we move up here to 6 minutes. And they give you the instructions what to do.
Step 1 is to shake the individual's shoulders and shout their name. If the person doesn't respond, you need to get assistance as soon as possible and call 911 right away. Step 2 is to call 911 if the individual is unresponsive. It's very important to call 911 with any suspected overdose because naloxone may wear off and the individual may overdose again. Step 3 is to start chest compressions or CPR if you know it and are trained. We want to push hard and fast in the center of the individual's chest with locked arms and interlocked hands. Push down at least 2 inches. Step 4 is to give Narcan. So first we want to peel back the tab of the Narcan nasal spray. Then we want to take the nasal spray and in the second image to the right, place your thumb at the bottom of the plunger and 2 fingers beside the applicator. You don't need to prime this or press a little bit beforehand. We just want to place our fingers in the image below. Then place the applicator into the individual's nostril, tilt the person's head back, and press the plunger into the nostril. Give the full dose. If you witness the person overdose on drugs, give Narcan as soon as possible. The individual doesn't need to breathe in this spray. The naloxone has a mechanism inside of it that pushes the solution far back into the nasal mucosa and is absorbed from there. The recommendation, if you need to give a second dose of naloxone, is to put it in the opposite nostril. If you forget, that's okay. Step 5, is it working? Give a second dose if the person does not start breathing within 2 to 3 minutes. Then repeat the same procedure as above until EMS arrives. Overdose response.
That's crazy. Leaving the person without oxygen, you have to stabilize first with respiratory assist. This is Toronto Public Health has safer consumption sites. Started in the fall 2017. Nurses are given respiratory assist because they can wake up with just the oxygen alone. All those signs that she told you proves the heart's beating. Your heart doesn't stop until you're brain dead from lack of oxygen. Pushing on the chest isn't going to do a dang thing. And this is what's been taught in Boy Scouts and Girl Guides from day one. They've known about it for over 5,000 years. It's a breathing emergency. Any poisoning, any drug overdose, you gotta breathe once every 5 seconds. If it's a breathing problem, give them air. Don't murder them with chest compressions. They're doing it to you on purpose. And everybody's making themselves sick saying nothing. It's costing you hundreds of millions of dollars. So many people left with permanent brain damage, lack of oxygen.
prepared. They all have naloxone. The most important thing when they get on site is actually ventilation as well as naloxone. But I think what we heard loud and
well, we were told today that, for example, because that precise example was used as to whether other first responders should have naloxone, and it was said that that was not the case, that the priority, for example, when the fire department are often the first to arrive, should be on ventilation, as Dr. Yaffe just said. But let me just say this about the